We've been concerned, perhaps to anticipate your next question, as our numbers have risen to as many as 10 patients. Where do we go next for COVID patients?
Dr. Doug Nelson with Kalispell Regional Medical Center says the COVID unit has 12 beds dedicated to coronavirus patients. However, with the rise in cases, he says the hospital is wondering what to do next. He says the hospital has carefully thought through each step, including keeping the COVID unit isolated from the rest of the hospital.
We've taken extra efforts actually to make the entire unit a negative pressure room so that there's not airflow coming from the COVID unit to other clinical areas. It's a zip-in on through a impermeable barrier type of unit. We very much restrict who can go in there, and healthcare workers have to wear full protective personal protective equipment.
Dr. Nelson says COVID patients are from Flathead and other counties, and the hospital has a plan if an outbreak happens. If that does happen, he says different floors of the hospital will be dedicated for COVID patients, ranging from slight symptoms to critical, with more than 20 beds available. Dr. Nelson says in anticipation of another outbreak, the hospital is hiring traveling nurses from other states to bring extra support.
Bringing in a relatively small number of traveling nurses now, but with the ability to scale up if we have a significant outbreak here and more patients to take care of.
Dr. Nelson reminds people to slow the spread of the virus, continue sanitizing your hands, wearing a mask, and properly social distancing. In Whitefish, Marin Sue, MTN News.